There is a bacterium that can turn your tongue black. Yep, you heard that right. It can turn your tongue completely black. This is not some horror movie or urban legend. This is real life, and this is just one of the many scary things about this deadly microorganism. In today's video, we are going to be discussing 20 scary facts about an infection caused by a rare bacterium called Arcanobacterium haemolyticum. So without further ado, let's get started. Number 20. Arcanobacterium haemolyticum is a gram-positive, anaerobic, non-spore-forming bacillus. While most of these terms might not mean anything to you, there are two important things to take away from this sentence. First, it's a type of bacteria known as a bacillus, which means it has a rod shape. Second, it's an anaerobic bacterium, which means that it lives in places where there is no oxygen, such as the bottom of lakes and the digestive tracts of animals. Number 19. This bacterium was first isolated from a sheep with a sore throat in 1984. However, it wasn't until 1988 that it was discovered in humans for the very first time. The first human case of this disease was reported in Japan in 1988, when a 26-year-old man presented with ulcerative tonsillitis and cervical adenitis. Number 18. Despite being discovered only a few decades ago, researchers believe that it may have been around for much longer. In fact, they suspect that it may have been misdiagnosed or simply written off as some other illness. For example, in 1978, a paper was published about a group of French schoolchildren who were suffering from tonsillitis. The authors of the paper suspected that the outbreak was caused by Streptococcus pyogenes, but when they examined the bacteria under the microscope, they noticed that it didn't look like Streptococcus pyogenes at all. Instead, it looked like what we now know as Arcanobacterium haemolyticum. Unfortunately, at the time, they did not have the tools to identify the bacteria definitively, so the case remained a mystery for another 10 years until the bacterium could finally be cultured and studied. Number 17. Acinetobacter haemolyticus is not a very common pathogen. In fact, it's relatively rare. Most of the cases have occurred in Asia and Europe. It is most common in children and young adults. Number 16. Symptoms of infection with Arcanobacterium. Haemolyticum can vary depending on the individual. Some people may experience mild symptoms, while others may become very sick. Symptoms can include fever, sore throat, swollen lymph nodes, headache, nausea, vomiting, fatigue, and a rash. As mentioned earlier, it can also cause your tongue to turn black. Numbers are 15. When examining a patient under the microscope, doctors look for the presence of small gram-positive rods. In addition, they will often perform a throat swab to collect samples of the bacteria. If the bacteria is present in the sample, it can usually be identified with a number of different biochemical tests. For example, catalase testing, which determines whether or not the bacteria produces catalase, an enzyme that helps to break down hydrogen peroxide. Another test that can be performed is the oxidase test, which determines whether or not the bacteria produces cytochrome C oxidase, an enzyme involved in the electron transport chain. Number 14. Treatment for infections typically involves antibiotics. The choice of antibiotic will depend on the severity of the infection and the individual patient. For example, penicillin is often used to treat streptococcal pharyngitis. However, if the patient is allergic to penicillin, then another antibiotic such as erythromycin or azithromycin may be used instead. Number 13. Prevention is always the best cure. That's why it's important to practice good hygiene, such as washing your hands frequently and avoiding close contact with sick people. This is especially important for those who are at high risk of developing complications from the infection, such as young children and pregnant women. Number 12. Arcanobacterium haemolyticum infection is sometimes referred to as the kissing disease. This is because the bacteria is spread through respiratory droplets, which are released when an infected person coughs or sneezes. These droplets can travel up to 3 feet and can remain suspended in the air for hours. They can also be picked up by surfaces such as doorknobs and toys. This means that it's possible to become infected even if you do not come into direct contact with someone who is sick. In fact, this is how most people become infected. Number 11. The incubation period for Acanthamoeba haemolyticum is typically 2 to 5 days, but it can be as long as 14 days. During this time, the person is contagious. This means that it's possible to spread the infection to others, even before showing symptoms. Once symptoms do develop, they can last anywhere from 1 to 4 weeks. Number 10. Most cases of Arcanobacterium haemolyticum infection are mild and resolve on their own within a week or two. However, in some cases, the infection can lead to more serious complications. For example, it can cause scarlet fever, which is a bacterial infection that causes a rash, fever, and sore throat. Scarlet fever is usually treated with antibiotics. In rare cases, it can lead to more serious complications such as kidney or heart problems. Number 9. Another complication that can arise from an infection with Arcanobacterium haemolyticum is rheumatic fever. Rheumatic fever is an inflammatory disease that can affect the joints, heart, and brain. It is usually triggered by a bacterial infection, such as an untreated case of strep throat. The bacteria releases toxins that can damage the heart and joints. This can cause symptoms such as pain and swelling in the joints, fever, fatigue, and rash. In severe cases, it can lead to permanent damage to the heart. Rheumatic fever is diagnosed based on symptoms and a physical exam. There is no specific test to diagnose the condition. Treatment typically involves antibiotics to kill the bacteria and anti-inflammatory medications to relieve symptoms. Number 8. This bacterium is able to survive in a variety of environments. It has been isolated from soil, water, and animals, as well as humans. This means that it's possible to become infected in a number of different ways. For example, it can be spread through contact with contaminated surfaces or objects. It can also be spread through contact with animals, such as livestock or pets. Number 7. This bacterium is able to survive in a wide range of conditions. It can grow in temperatures ranging from 25 degrees Celsius to 37 degrees Celsius, which is equivalent to 77 degrees Fahrenheit to 98.6 degrees Fahrenheit. This means that it can survive in a variety of different environments, both inside and outside of the body. Number 6. This bacterium is known to be resistant to a number of different antibiotics. This means that it can be difficult to treat infections caused by this bacterium. For example, it is resistant to penicillin and other beta-lactam antibiotics. This is a scary fact because penicillin is one of the most commonly used antibiotics to treat bacterial infections. The fact that this bacterium is resistant to penicillin means that we need to use stronger antibiotics to treat infections, which can lead to more side effects. Number 5. One of the scariest things about this bacterium is that it can cause severe illness in pregnant women. Pregnant women are already at increased risk of developing complications from bacterial infections. This is because the immune system becomes weakened during pregnancy in order to prevent the body from rejecting the fetus. This means that pregnant women are more susceptible to developing serious complications from infections with Arcanobacterium haemolyticum. These complications can include miscarriage, stillbirth, and premature labour. Number 4. You might be wondering if there is a vaccine available for this deadly virus. Unfortunately, at this time, there is no vaccine available for Arcanobacterium haemolyticum infection. Because it is a relatively new disease, it has not yet been added to the list of diseases for which routine vaccinations are recommended. However, researchers are working on developing a vaccine. Several different types of vaccines are being studied, including live attenuated vaccines, subunit vaccines, and mRNA vaccines. It is hoped that one of these vaccines will soon be available to help protect people from this deadly disease. Number 3. This bacterium has been found to cause disease in a wide range of animals, including cattle, sheep, goats, pigs, horses, and dogs. This means that it is possible to become infected through contact with these animals or through the consumption of their products, such as meat or milk. Number 2. This bacterium has been found to produce a number of different toxins. These toxins are responsible for many of the symptoms associated with infection, such as fever, sore throat, and swollen lymph nodes. In addition, it has been found to produce a toxin that is similar to diphtheria toxin. This toxin can cause serious damage to the heart and nervous system. Number 1. This bacterium has been found to be highly transmissible. This means that it can spread easily from person to person. This is one of the scariest things about this bacterium because it makes it difficult to control the spread of the disease. And that's all for today's video. If you enjoyed it, please leave us a like and subscribe for more videos like this in the future. Thank you for watching.